My name's Gary Hawkins. I'm the founder and CEO of Nebs Systems. I am also a NHS clinical entrepreneur, learning disability nurse, and I still work for NHS England doing care, education, and treatment reviews. Nebs is a platform, cloud-based platform that matches the exact needs of an individual to a placement in the community to support discharge from hospital for people with mental health, autism, and learning disabilities. I got onto the clinical entrepreneur program and I just met people who spoke the same language that I did, who were driven to try and make changes in the NHS. It's about finding your tribe, but it's about just the language. And what I found really interesting about the clinical entrepreneur program was there's no hierarchy. I was the first ever learning disability nurse to get onto the program, not the first nurse, but certainly the first LD nurse to get onto the program. But I was sat and having these conversations with consultant neurologists and professors, but we all still spoke the same language and we became equal, which I actually found just enlightening, but coming from a nursing background. Mentors in the program are industry experts. They've been there, they've done it, they've got the badge, the mug, and the t-shirt. The advice and the direction and the growth that they give you is incredible. They like gold dust, and that really is one of the big things also of the clinical entrepreneur program, is to have those mentors who understand what you're doing and they've been there, they've made mistakes possibly, and they can share those mistakes with you, because entrepreneurship is about failure as much as it's about success. What's so lovely is that you're never really out of the program as well, and you just end up with this massive supportive community that you can access, and I do this, it's just magical. Go for it, believe in yourself. Nurses and AHPs, and I want to extend that beyond nurses, but all that sort of health professionals, and you don't need to be qualified. It's about individuals in the NHS who see a problem, who want to fix it. But for nurses, have that belief that you can actually make a real change in services and patients' journeys. If I had to choose three words, it'd be transformational, inspirational, and magical.